I was one of the first med students that participated in the Bridging the Gaps programs at University of Pennsylvania. And I feel like the program has come full circle because today I find myself as a preceptor for the current Bridging the Gaps program. This is my second year as medical director of the Sickle Cell Disease Association of America, Philadelphia, Delaware Valley chapter. We've hosted students, dental students, medical students, social work students that participate in the program and have helped us with our community initiatives, worked with our clientele to develop programming for us and with us, and also assisted on new grants that I've gotten into the office. So as a community-based organization, their role has been powerful. And as a preceptor, I feel like I'm giving back to the program because it really helped me focus and sculpt what my career was going to be, and it gave me invaluable experience. Being part of Bridging the Gaps completely affected what I did when I finished med school and went to residency program. I was excited to get a chance to connect with the community that I was in, because I came from New York, so Philadelphia was a new place for me. And there was something in their dialogue that struck me in that as a provider, you need to know your community. You will be best served if you connect with the people around you. Being out and about in the neighborhood and feeling like you were not necessarily having to apply medical knowledge, but using it and learning in the process and seeing where it would be applicable was awesome. Finding your place at the beginning was a struggle, I think, because you wanted to be helpful, you wanted to be hands-on, but you weren't sure what they expected of you. So, kind of green behind the ears, so to speak, and, deer in the headlights sensation. But once that first, I would say 3 to 4 weeks went by, you really were appreciated. I really felt like the organization that you participated, for me anyway, it gave me as much as I gave it, and I looked forward to going every single day. Even though people said, oh, it's in the worst neighborhood in Philadelphia, and all those patients have so many problems, because you get that as a newcomer to the area. People will tell you everything they can about the location that you're going to. I thrived. I absolutely loved it, because I felt like I was really giving them something that was going to affect their lives. And in listening to them, I then applied that to later years in med school. I know what my patient population is going to really need. I shouldn't, give them fluff. I can get to the meat of it, and then I can really, it helped me get a conversation started so that I could extract the information that I needed from them. Being in a clinical situation is one thing, but stepping out of clinics or stepping out of the hospital arena allows you to see the challenges that individuals face, and part of delivering good health care is exactly that, helping them manage their lives along with the medical and so on and so forth. So deciding to become medical director for a nonprofit, I think totally speaks to what the program teaches you and gets you to do. In other words, using your skills in order to improve the lives of the individuals in your community. And in doing that, then you uplift the community itself. You go to where the problems are, and you're like boots on the street. You're like the army that gets the work done. So then that'll make, hopefully, the clinic visit and the hospital and all the other things smoother and function better for that individual in their lives. Just by having the experience through Bridging the Gaps, you change your perspective on the potential of what your career will offer people once you are done. And that is so powerful because we are interconnected through each other. So being able to be sensitized to that so that you're not having to learn it afterwards. You go into your career knowing that puts you ahead of the individuals, I think, to do your job, whatever it is, better than who have not had that opportunity. When talking to colleagues and other people that have participated, I have heard that in designing programming, in offering services at the locations that they are, the tools that they gained through Bridging the Gaps. I think when we learn how to make connections, when we learn how to get out into the neighborhood and almost build our portfolio of who are our accessory arms in order to get the job done better. They definitely have shared with me, and I've shared with them, that had I not had the training, it would have been so much more difficult. Also, if someone presents themselves in their office and they're talking about what their challenges are, for instance, having gone to the program, that challenge, the challenges that the person that you're interacting with are real challenges. You get an image in your head because you participated in this program that you know exactly what that person is going through, and you can relate to them so much quicker that it just amplifies the job that you're able to do. If you're thinking about participating in Bridging the Gaps and you're on the fence, I will tell you that it will give you the experience of a lifetime, and it'll impact your career path in such a way that you're a better person. And if you can grow in that sense, if you have the opportunity to grow at the beginning of your path, as opposed to trying to make it up at the end, and you're trying to decide between other things, I think the benefits so outweigh any questions that you might have. If you think about the connections that you'll make, the people that you'll meet, you might circle around in 5 years down the line. That one connection is what gets you the career that you need, or makes the difference between you and another candidate, because you're able to speak to the issues in a different way because you've been entrenched, so to speak. And other individuals have not been. They're all book. And as much as we need to study and get those skills, being able to apply them, being able to relate to individuals, being able to be sensitive to the needs, and being able to pick up on that pipeline, because some people, it might be around them, but they don't pick up on the changes and nuances until you are in the middle of it all. Bridging the Gaps is the program for you.